Welcome to our course on the principles of pharmacology. As nurses, understanding how drugs work in the body is crucial for providing safe and effective patient care. Today, we'll explore four fundamental concepts that form the foundation of pharmacology. First, pharmacotherapeutics refers to how we use drugs to treat disease. Next, pharmacokinetics describes how the body affects drugs over time through four key processes: absorption, distribution, metabolism, and excretion, commonly known as ADME. Pharmacodynamics focuses on how drugs affect the body at the cellular level. Lastly, pharmacogenomics examines how a person's genetic makeup influences their response to medications. These concepts are essential for making informed clinical decisions in your nursing practice. Let's dive deeper into pharmacokinetics by examining how drugs move through the body. This process begins with absorption, where drugs enter the bloodstream through various sites, primarily the gut to plasma. Distribution follows, as drugs move from plasma to different tissues. The liver plays a crucial role in biotransformation, while the kidneys are primarily responsible for elimination. Each of these processes involves important concepts like bioavailability, volume of distribution, enzyme interactions, and clearance rates. Understanding these processes helps us predict how drugs will behave in different patients and why dosing adjustments may be necessary. Drug absorption is influenced by several key factors. The chemical characteristics of a drug, particularly its ionization state and lipophilicity, significantly affect how well it crosses cell membranes. Non-ionized drugs generally cross membranes more easily than ionized forms, and pH levels can greatly impact this process. The route of administration also plays a crucial role, whether it's oral, subcutaneous, intramuscular, intravenous, or topical. For oral medications, various GI factors can affect absorption, including stomach pH, food presence, and transit time. Blood flow to the absorption site and cell membrane characteristics also influence how effectively drugs enter the bloodstream. Bioavailability tells us what percentage of the drug actually reaches systemic circulation. When we consider drug distribution, several factors come into play. Once in the bloodstream, drugs must cross various membrane barriers to reach their target tissues. Plasma protein binding is particularly important. When drugs bind to proteins like albumin, they can't leave the bloodstream to act on tissues. The volume of distribution helps us understand how widely a drug spreads throughout the body. Distribution occurs in two phases. First, to highly perfused organs like the heart and brain, and then to less perfused tissues like muscle and fat. This process becomes especially important in elderly patients, where changes in body composition can significantly affect drug distribution. The extent of drug distribution varies significantly between tissues. Protein-bound drugs remain primarily in the bloodstream, while unbound drugs can move more freely. Water-soluble and fat-soluble drugs distribute differently. Fat-soluble drugs can accumulate in fatty tissue, potentially prolonging their effects. Special consideration must be given to barriers like the blood-brain barrier and placental barrier, which restrict the passage of certain drugs. When we look at a drug's concentration time graph after intravenous administration, we can clearly see both the distribution and elimination phases, helping us understand how drug levels change over time. Drug metabolism, or biotransformation, is crucial for converting drugs into forms that can be more easily eliminated from the body. This process serves five main purposes, including making drugs more water-soluble for excretion. Metabolism occurs primarily through Phase 1 and Phase 2 reactions. Phase 1 involves oxidation, reduction, or hydrolysis, while Phase 2 involves conjugation reactions. The cytochrome P450 system, located mainly in the liver, is responsible for many Phase 1 reactions. Genetic variations in these enzyme systems can significantly affect how individuals metabolize drugs, leading to different therapeutic responses among patients. Individual variations in drug response often stem from differences in CYP450 enzyme activity. Some people may be poor metabolizers, while others are rapid metabolizers, affecting how quickly drugs are processed in their bodies. The first-pass effect occurs when drugs are metabolized by the liver before reaching systemic circulation, particularly affecting oral medications. Some drugs, called prodrugs, actually require metabolic activation to become therapeutically effective. Looking at concentration graphs for drugs like diazepam and its metabolite desmethyldiazepam helps us understand how metabolism affects drug levels over time. Drug elimination is the final step in the pharmacokinetic process. While drugs can be eliminated through various pathways, renal excretion is often the primary route. Factors affecting renal excretion include blood flow to the kidneys, filtration rate, and urine pH. Clearance, which measures how quickly a drug is removed from the body, is particularly important. Creatinine clearance serves as a key indicator of renal function, helping us adjust drug dosages appropriately. As people age, renal function typically declines, necessitating careful consideration of drug dosing in elderly patients. Understanding chronic kidney disease stages is crucial for medication management. The disease is classified into 5 stages based on glomerular filtration rate, GFR, with each stage requiring different dosing considerations. Drug half-life, the time it takes for drug concentration to decrease by half, becomes especially important in kidney disease. As kidney function declines, drugs may accumulate if doses aren't adjusted appropriately. Reaching steady state, where drug administration and elimination are balanced, takes about 4 to 5 half-lives. This knowledge is crucial for safe medication administration in patients with compromised kidney function. Let's conclude by examining therapeutic blood levels and steady-state concepts. When administering medications, we aim to maintain drug concentrations within the therapeutic range, above the minimum effective concentration, but below toxic levels. Steady state is typically reached after about 5 half-lives of consistent dosing, with drug levels progressively increasing from 50 to 100% of the final steady-state concentration. Sometimes, loading doses are used to reach therapeutic levels more quickly. Understanding these principles helps ensure safe and effective drug therapy. Remember, as nurses, your knowledge of these pharmacokinetic principles directly impacts patient care and safety. If you enjoyed this lesson, don't forget to subscribe to the channel for more nursing tips and practice questions. See you in the next class.